Good morning, good morning, good morning, good morning, good morning, good morning. We are now on the chapter 9 of this book, Dr. Alice Women's Health Bible. Chapter 9 discusses about general disorders and problems. While problems and conditions such as PMS or prolapse of the uterus are obviously specific to women, there are also a number of more general disorders which statistic tells us afflict women much more often than men. These include chronic fatigue syndrome, migraines, and some of the autoimmune illnesses such as lupus and Sjogren syndrome. I have also included at the end of this chapter a special feature with general therapeutic advice on managing long term illness, such as might stem from cancer or HIV, and preparation for and recuperation from surgery. General health problems. This list by no means covers every health problem you might encounter, but does include the most common complaints. Lupus. Lupus. Systemic lupus erythematosus. Systemic. Systemic lupus. Er, erythematosus. Systemic lupus erythematosus or SLE is an autoimmune disease in which antibodies are deposited in various tissues of the body. About 90% of sufferers are women of childbearing age. It seldom affects postmenopausal women. Antibodies are generally produced to protect the body against foreign particles, living or non living. In lupus, the immune system attacks its own tissues because some minor changes in the protein structure of these tissues have been perceived as hostile. Symptoms. The muscular and connective tissue are usually the first to show sign of this disease. Almost all sufferers first experience muscular skeletal problems. Joints and surrounding ligaments swell up and are painful, and muscles become inflamed and are sore to touch. Another symptom is the appearance of a butterfly rash. Butterfly rash across the cheeks and bridge of the nose. This is caused by antibody deposits in the connective tissue of the skin. Ultraviolet rays can aggravate this rash. General symptoms of lupus are chronic fatigue, malaise, chronic fatigue, chronic fatigue, malaise, occasional fever, loss of appetite, nausea, vomiting, and weight loss. This, coupled with joint or bodily aches, are the first sign of the disease. Your doctor will carry out blood tests to check for special antibodies, which will continue the diagnosis. If the lupus spreads to other symptoms, if the lupus spreads to other systems in your body, complication can be numerous. In about 50% of women with lupus, protein and blood are found in the urine. In severe cases, death is usually the result of kidney failure. The nervous system is frequently affected, producing tingling, burning, loss of sensation, and loss of function of parts of the body. Depression, anxiety, insomnia, and loss of memory are also common. The blood clotting system is affected. Clots may cause deep vein thrombosis, stroke, or pulmonary embolism, blood clot in the lung, or clotting ability may be reduced, resulting in easy bruising and nose bleeds. Pleurisy, pleurisy, pleur, pleurisy, pleurisy, and pleural infusion. Effusion, pleurisy, and pleural infusion. Accumulate Accumulation of fluids between the pleural membranes of the lungs are common. This may cause coughing and breathing difficulties due to fluid pressure on the lungs, and breathing may be painful when the two pleural membranes rub one against the other. Hirap. Lupus can attack the bulbs of the heart, causing circulatory problems, heart failure, or heart attacks. Gastrointestinal complications involve diarrhea, abdominal cramps, and intestinal blockage. If the intestinal wall is perforated, poisoning of the peritoneum is a dangerous possibility. Poisoning. Poisoning of the peritoneum. Lupus frequently affects the eyes, particularly the blood vessels of the retina. Blindness may develop within days. Treatments. Although there is no cure for lupus, it is possible to achieve remission, where you can be symptom free for long periods of time. The disease itself is not necessarily life threatening unless the kidneys, brain, or heart are severely affected, but the fatigue and pain are debilitating. Generally, steroids and immunosuppressants are used to control the symptoms. Cytotoxic sa Cytotoxic. Anti-cancer drugs are also used in severe cases to suppress the autoimmune response. All this come at a price, as the risk of damage to the liver and kidney is high, and this needs to be monitored during therapy. Following the lifestyle program, combining diet, massage, exercise, and relaxation has helped many of my patients go into a long remission. Some feel so much better than they eventually return to their original lifestyle. but this often brings the symptoms back. Massaging the joints with oil containing lube, mustard, massaging the joints with oil containing lube, mustards, and other herbs that help reduce inflammation and combat pain aids in controlling the inflammation of the joints and the adjacent muscles, bringing good relief. It's really the lifestyle. Arthritis. Rheumatoid arthritis. Rheumatoid arthritis. This should not be confused with rheumatism, even though loss of mobility in the joints is a characteristic of both. Rheumatism is caused by a bacterial infection. Mm. This should not be confused with rheumatism, even though loss of mobility in the joints is a characteristic of both. Rheumatism is caused by a bacterial infection. Strep, Streptococcus. Streptococcus. Rheumatism is caused by a bacterial infection, Streptococcus, causing changes in the heart tissue as well as the joints, and widely affects men as well as women. Rheumatoid arthritis is a chronic autoimmune disease. Rheumatoid arthritis is a chronic autoimmune disease by which the body's immune system attacks its own joints, membrane, and cartilage. It is three times as common in women, and there is a strong hereditary link. Symptoms: the disease starts off with fatigue, loss of appetite, muscle ache, and joint stiffness, especially in the morning. But these general symptoms make it difficult to diagnose at this stage. Then the joints begin to show typical signs of inflammation, swelling, heat, redness, and pain. Hands, wrists, feet, and knees are most frequently affected. Shoulder joints are usually only affected much later, and the pain and swelling may shift from one to the other. The inflammation restricts the joints' mobility. The pain is worse with movement, and the joints get very stiff. Later, the cartilage is affected, as are small blood vessels inside the joints. This causes the joints to deform or become fused, and eventually the bone ends themselves erode. Treatments. Treatment is aimed at relieving the symptoms rather than curing the disease. Conventional medicine offers two basic forms of treatment: painkillers or anti-inflammatories, directed towards reducing the pain and inflammation, or cytotoxic immune suppressant drugs, which suppress the angry reaction of the disease. Although this help, they do so at a great cost to the body. Immunosuppressants can adversely affect other healthy tissues, and kidneys and liver damage is common. Steroids, generally used to curb the inflammation, suppress the body's own natural steroids, and side effects includes osteoporosis, weight gain, thinning, and aging of skin and hair loss. Integrated medical treatment involves following the lifestyle program to boost your body's own defenses and reduce all unnecessary strain on the body's system, combined with the following: swimming and gentle yoga. Exercise can be painful but gentle, and strain movement is useful to keep the muscles toned. If the joints become frozen, have no role. Hmm? Ha? Ni.
Ano ko sa anak ko, ilagay lingon sa anak ko. Maligid daw siya. Sugon lang mga ilang. Narito ang koy. Nagbarato siya, tagparinta na nakagat ko. So, nakita ko ng drink.
Sige. Pabilisan natin. Ato ko. Labi? Pila? If the joints become frozen, muscles have no role to play in atrophy very quickly. Massage of the affected joints at bedtime with oil permulated to reduce inflammation and pain. Coral calcium dissolved in water. Coral calcium. Coral calcium. Coral calcium dissolved in water. This releases calcium ions that are more easily absorbed by the body. Various herbal supplements typically include turmeric and powdered ginger to help to control inflammation naturally. Ayurvedic panchkarma treatment. Ayurvedic. Ayurvedic panch panchkarma. Panchkarma. Panchkarma treatment. PENCH Karma. Ayurvedic Panchkarma treatment. This has helped to bring about remission in many people. The oils reduce the inflammations and help the body to heal itself. It also helps keep the muscles tuned. Acupunctures and homeopathy are very useful therapies that have helped patients with rheumatoid arthritis. Acupuncture. Joe, Jogreen, Jogreen, Sjogren's, Sjogren, syndrome, Sjogren syndromes. Sjogren's syndrome is another form of autoimmune disorder. Around 90% of people affected are women and is most frequently occurs in their 30s. Sjogren is characterized by progressive destructions of the exocrine glands. Exocrine glands. These are responsible for producing saliva and the moisture that baths our eyes. Symptoms consequently are gritty feelings, dry eyes, and an extremely dry mouth. The throat and the lungs may also feel dry, making the voice hoarse and producing a persistent cough. It can be almost impossible to swallow any dry food, and sufferers find themselves on a mostly liquid diet. Sometimes the kidney can be affected. Treatments. I have not had any success in treating this condition. In the early stages, there may be some hope of controlling its progression by strictly following the lifestyle program, which is directed towards optimum functioning of the body. Steroids are used to control some of the symptoms, but treatment is mostly symptomatic. Lubricating ointments for the eyes, nasal sprays, frequent sipping of water, a liquid diet, and so on. Pure rose water can be used to moisten the eyes, and dry tamarind stirred into water and sip can help saliva secretion and keep the mouth moist. Past trauma, present problem. I have found that 90% of my patients with lupus, rheumatoid arthritis, and Sjogren syndromes have reported whiplash injuries, falls, bangs on the head, or similar injury in the past to their head or neck, or birth trauma, forceps delivery, cord around the neck, rapid birth. Since the pituitary adrenal link is essential for the healthy working of the immune system, I believe it follows that a malfunctioning pituitary can lead to autoimmune disease. Therapy that works specifically on alignment of the vertebrae in the neck and therefore improving blood flow to this part of the brain, such as osteopathy, yoga in my neck and shoulder massage technique, assists the pituitary to function better and helps control the aggressiveness of the disease. Thyroid. Thyroid problems. The thyroid gland, located over the pipe, windpipe at the front of the throat, is the source of hormones that control the body's metabolism. Their effect is widespread throughout the body, accelerating the heart's rate and force of contraction, increasing the turnover of minerals in bones, production of red blood cells, stimulating the activities of other hormones such as adrenaline, influencing growth and maturations of tissues in the body's repair and regeneration. Thyroid problems, which are more prevalent in women, stem from secreting too little or too much of the thyroid's two main hormones, T3 and T4. T3 and T4. These in turn are dependent on stimulation by thyroid stimulating hormone or TH TS TSH TSH. Thyroid stimulating TSH. TSH. From the pituitary. Inadequate production is called hypothyroidism, and excess production is called hyperthyroidism. Inadequate production is called hypothyroidism. Inadequate production is hypothyroidism. Hypothyroidism. And exist production is called hyperthyroidism. Causes. The thyroid requires iodine to function, and in some parts of the world, iodine deficiency in the soil and therefore in the diet makes hypothyroidism endemic. However, in the developed world of thyroid problem is much more likely to be caused by an inability to absorb and process iodine effectively, an autoimmune malfunction, which tends to run in families, or a highly unbalanced diet. And exists of the few foods that block iodine absorption, including turnips and raw brassicas, can result in hypothyroidism. And exists of the few foods that block iodine absorptions. Turnips. Ah, so it's bad. Turnips and raw brassicas. Brassicas. It's not ideal to take more on turnips. Can result in hypothyroidism. More likely if production of T3 and T4 is a little low anyway. In uncontrolled use of iodized salt can introduce too much iodine into the system, leading to hyperthyroidism. Mm. Symptoms: hypothyroidism, underproduction, low adrenaline causing slow heart rate, low blood pressure, and general fatigue and lethargy. Weight gain from slow metabolism, sluggish response to stress leading to depression, other hormonal problems causing period disturbance, anemia. Nandito siya. Diha na, ibuhos na. Bumili kami ng koi fish. We buy koi fish. Symptoms: hypothyroidism, underproduction, low adrenaline causing slow heart rate, low blood pressure, and general fatigue and lethargy. Weight gain from slow metabolism, sluggish response to stress leading to depression, other hormonal problems causing period disturbance, anemia, weak bones, osteoporosis from poor turnover of mineral content in bones, feeling cold, low body temperature, hair loss, and dry skin. Hyperthyroidism, overproduction, high blood pressure, and fast heartbeat with constant palpitation can lead to an enlarged heart as the muscle is overworked, increasing the risk of heart attack. Weight loss from high metabolic rate, burning up energy, fatigue, tremors, and insomnia as the body is in a state of high alert. Skin flushes and moist with perspiration, restlessness, anxiety, feelings of anger or rage, diarrhea as the motility of the gut increases, bulging eyes. Both under and overactivity of the thyroid gland may cause it to increase in size, forming a swelling at the front of the neck called a goitre. Graves disease. Graves disease. Graves disease is a hyperthyroid condition characterized by an enlarged thyroid gland, Goitre retractions of the eyelids, giving the eyes a bulging, fearful look resulting from overstimulations of the sympathetic nervous system, premature graying of the hair, skin condition that includes vitiligo and specific skin irritation behind the thigh, calves, and on the soles of the feet. The affected areas develop an orange peel look and open itch. Hashimoto's disease. Hashimoto's Hashimoto's disease is an autoimmune condition in which the immune system mistakenly attacks the thyroid tissue and blocks its activity. The infiltrations of white blood cells into the thyroid result in some inflammations and enlargement of the thyroid, but the levels of thyroid hormones remain normal. Hashimoto's disease is an autoimmune condition. Basahin. I'll repeat what I read because of the noise. So sorry for that. Hashimoto's disease is an autoimmune condition in which the immune system mistakenly attacks the thyroid tissue and blocks its activity. The infiltration of white blood cells into the thyroid results in some inflammation and enlargement of the thyroid, but the levels of thyroid hormones remain normal. Treatments. Hypothyroidism is generally treated with thyroxine, 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 as a form of hormone replacement therapy. Hypothyroidism is general treatment with thyroxine as a form of hormone replacement therapy. Thyroxine is not necessarily something that must be taken forever. Checks, usually every 6 months, should be made on your hormone levels because sometimes the thyroid function return to normal and then taking thyroxines can cause hyperthyroidism. Mm. Sometimes, as I have seen in my patients, improving the pituitary's function by neck massage in an improved lifestyle can improve the secretion of TSH and so regulate the thyroid. This enables patient to come off thyroxine. Natural treatments include sea kelp, sea kelp, which is rich in iodine. Natural treatments include sea kelp, which is rich in iodine. Even if the thyroid returns to its normal function and the weight gain brought on by the slowed metabolism remains, some women are led to believe that by taking thyroxine the excess weight will go. This doesn't happen unless they go into a state of thyroid toxicity, which brings with it all the complications of hyperthyroidism, not just weight loss. The only answer is a strict ultra low fat diet and exercise. Hyperthyroidism is a toxic, potentially fatal condition which requires taking drugs that block the effect of the thyroid hormones and the surgical removal of the part of the gland. I have not found any natural way of dealing with hyperthyroidism. Migraines. Migraines. All migraines are headaches, but not all headaches are migraines. All migraines are headaches, but not all headaches are migraines. More women than men suffer from them, and cyclical migraines are often associated with the menstrual cycle. Mm. Symptoms. The name derived from the words Hemi, Hemi, help, and cranium, cranium. Hemi, the names derive from the words hemi-half and cranium skull because a severed headache on one side only is a characteristic symptom. Other typical symptoms are photophobia or sensitivity to light. This may also take the form of seeing flashes of light or auras around objects and people. Saman, sensitivity to sound, nausea and vomiting. Vomiting does give temporary relief from the headache. Loss of vision during a severe attack. Ringing in the ears. Mhm. There is often a discernible pattern to migraine attacks. Some women experience them as clustered. having several in close succession and then a long period without any trouble. Attacks linked to menstruation come 2 or 3 days before a period starts and are often relieved as soon as bleeding starts. They recur month after month and rarely occur mid cycle. An attack usually lasts 2 or 3 days. If you suffer from migraines, you may have come to recognize the warning signs that an attack is imminent, which could be great agitation or discomfort, or a feeling of depression, weakness, and fearfulness. You may also have learned that certain things can trigger an attack. Chocolates or chocolate and cheese in combination, and certain perfumes are common causes. Treatments. Drugs that improve blood flow to the brain dampens the intense throbbing of the headache. These work either by dilating the blood vessels or reducing the blood's viscosity, thinning it so that it can flow more easily through the arteries of the brain, or by slowing down the heart rate, beta blocker. However, the headache, although less severe, will still last 2 or 3 days, and the next attack will be at full force. I have treated hundreds of patients with migraines, and I have come to the conclusion that the attacks get less severe and frequent, or even disappear, only when an integrated approach is taken. Diet. Drink plenty of water and calming herbal teas such as peppermint and chamomile. Avoid anything that excites the system or raise blood pressure, especially coffee, excess salt, alcohol, particularly red wine, sugar, citrus or sour fruits, yes products, cheese, mushrooms, MSG, the flavored enhancer used in most commercial Chinese food, canned products, vinegar, nuts, chilies, fried food. Fried food. Massage. A neck and shoulder massage is crucial in helping to improve blood circulation to the head. Work particularly on the side on which the headaches occurs. Include the jaw and jaw joint on the side of the headache. The jaw joint often becomes the epicenter of the headache, spreading up to the temple of the forehead. It is possible to do this massage yourself, but better if someone else does it. It may be well worthwhile visiting a professional for massages during this period. Relaxation. If you notice a pattern to your migraines, listen to a relaxation tape or CDs every evening during the week before the expected date of an attack. Relaxation exercise also help. Other steps: you must get enough sleep, avoid late nights, sleep with only one pillow. Make sure you take breaks between prolonged computer use. You must not allow your neck to get stiff, as this will always make the attacks worse. Try to identify possible triggers. Prime suspects are perfumes, strong aromatic oils, chocolate and caffeine, or a particular combination of this. Follow this program for 6 months, being especially strict a week before your period when the headaches are due. The aim is to break the cycle. If the intensity and duration of the headaches reduce, then you know you are on the right path. The migraine should become less frequent and you may go for 2 or 3 months without an attack. That is a good sign of recovery. What goes around comes around. The cause of migraine is understood to be linked to blood and fluid circulation in the brain, but why they are so often cyclical is not exactly known, as well as the familiar cycles that journal day night, which is upset by jumping time zones, and monthly ovulation and menstruation. Our bodies run to numerous cycles of which we seldom take any account emotional. Approximately 23 days. Physical energy, approximately 27 days. Red blood cells renewed every 125 days. Skin replaced every 27 days, and so on. A migraine cycle may be the body's reaction to some internal changes that take place. It is perhaps a very crude and uncomfortable way of forcing the body to rest periodically for a couple of days. Headaches. Mm, Headaches. Headaches are the most common medical symptoms and their cause are legion, from stiffness in the neck or jaw, area to black sinuses to dehydration, to constipation to a brain tumor. Low blood pressure or low blood sugar can trigger a headache. So can high blood pressure or high blood sugar. Withdrawal symptoms, such as when giving up coffee, alcohol, smoking, or drugs, are often include headaches, and headaches are often a component of a high altitude sickness. In fact, the body can respond with a headache to almost any internal change. If you frequently get headaches, finding out the cause will help. Treatments. About 80% of all headaches stem from the neck area. Massage and manipulations of the neck, shoulder, and jaw area can give quite relief. The improved blood flow combined with improved flow of cerebrospinal fluid, which bats the brain surface and supplies it with nutrients, means that more oxygen and glucose get to the brain. Many of the causes described above and have their roots in a poor supply of oxygen or glucose. For sinus headaches, oil formulated for clearing the sinuses is available from medical herbalists. Put 2 drops in the nostril twice daily for a month. Rub peppermint balm on the forehead and the pressure points at the inner end of the eyebrows, adjacent to where the bridge of the nose meets the forehead. Avoid ice, cold water, or chilled drinks, which can make black or inflamed sinuses more painful. Avoid mucus producing substances such as dairy products, spicy, or citrus food, which encourage saliva production and other secretion. Make sure you are not constipated. Constipation tends to lead to greater production of nasal mucus as an alternative way of ridding the body of toxins. CFS or chronic fatigue syndrome.
Balat ko na sa patagis dagpo naman no. Kung magmapit din.
NME. MA or mia,
Ha?
myalgic
Orat.
encephalomyelitis. pa low my so man na a syndrome, chronic fatigue syndromes, and ME, myalgic encephalomyelitis. A syndrome is a collection of symptoms that are present together to form an illness. Unlike a disease, there is no underlying cause, and the symptoms simply appear together. Irritable bowel syndromes and premenstrual syndromes are other examples. More women than men suffer from CFS, and it has become a social and health concern, bringing work and home life to a grinding halt. Symptoms. Although chronic fatigue is a symptoms in at least 90% of cases, other manifestation of CFS include lack of concentration in a fuzzy or foggy head, short-term memory loss, cravings for sugar, depression, insomnia or reverse sleep pattern, bloating and abdominal gas, occasional period disturbances, muscle of general body ache, blurred vision, dizziness and nausea on movement. Some or all of this leads to further typical problems associated with CFS: weight gain, loss of libido, and a feeling of helplessness brought on by a poor response to medical treatments. Causes. In my observations, I have found that people with this illness fall into three different categories. Poor blood supply to the brain, particularly via the vertebrae arteries in the nape. Brain scans with radioactive glucose or PET scan shows that 60% of those who have CFS have perfusion, poor perfusion of blood in the brain. This supports my hypothesis that chronic stiffness in the neck or misalignment of the cervical vertebrae inhibiting the flow of blood to the brain's limbic system and the hypothalamus will produce symptoms such as poor memory and concentration, hormonal imbalance, headaches, dizziness, and disturbed sleep pattern. The root cause can be long hours at a computer or behind a steering wheel, neck injuries, stress, or even excessive dental work or high pillows. Sama. Then, post-viral fatigue, about 20% of cases. This type of CFS is often called myalgic encephalomyelitis. The full name means muscle aching inflammation of the brain and nerves, which I think is a misnomer, as there is no evidence of brain or nerve inflammations in muscle ache. It's only one of the symptoms. Overwork, a poor diet, frequent traveling, or prolonged stress makes you vulnerable to viral infection. An infection like this weakens the system further, and if you do not allow yourself to recover fully, the fatigue becomes devastating. You simply cannot move, every muscle aches, and you develop all the symptoms listed above. This type of CFS takes a long time to recover from as the body's function reduced to extremely slow pace and take quite an effort to kickstart. Other miscellaneous factors, about 20% of cases. Among these are nutritional imbalances, anemia, iron deficiency, or low red blood cell count, very low blood pressure, chronic sinusitis. This makes the eyelids very heavy, which feels like fatigue, low blood sugar, candida in the gut, yes, producing toxic alcohols in the system, cause fatigue, low hormone levels, and obesity. So I'll just end this, my reading period. Say there's a lot of interruption already. It's already 8 o'clock here, and it's time for me to do my business. That's all for today. Actually, it's only a few pages, and we are done. But ang dami ng interruption. So it's better to end this for today. God bless everyone. Bye bye.